name is Klaus Schuster. I'm speaking here from the medical center at the Vevey railway station, Centre Médical Gare de Vevey. The reason we're doing this video is to keep you informed about the coronavirus. The coronavirus has been taking got enormous attention in the media the last months. The pandemic started in China, where about 80,000 people have been tested as positive, and the last numbers we got is that about 2,912 people have died. Now this virus has also arrived in Switzerland and is affecting us in our daily practice. We have a lot of people coming and want to learn about this virus and have a fear that they might have attracted the virus. We have people calling us. So here are some criteria that should help you to have some orientation about what to do and when to do and when to take action. Now when people have got a high fever, let's say 39-40 degrees, that's certainly a parameter which is important, and especially when the high fever is associated with a respiratory tract problem. So when you have got dyspnea or a cough and a high fever, it is a virus that affects primarily the respiratory tract system. Now then you have to be aware that it could be a coronavirus infection, and if you have been close to a person with the same symptoms over something like 15 minutes and within a radius of 2 meters, then the recommendation from our authorities is, well, then you should go and test. So the recommendation comes from the Médecins Cantonal in Lausanne, and they told us somebody has got these 3 parameters: high fever, respiratory tract symptoms, and has been close to a person with the same parameters over 15 minutes within a radius of 2 meters, then you should go and test. Now where can you do testing? Testing you can do here in our part of the canton and in the east part of the canton Vaud, in the Hôpital Rivière-Chablais, which is in Rennes. Now if we identify a case on the phone who has got these 3 parameters, then we're going to send them straight to the Hôpital Rivière-Chablais, or we give some recommendations what to do to prevent transmission. Now one action you can take to prevent transmission is to do proper hand disinfection, meaning you buy something like that in a pharmacy and it's an alcohol containing gel. You put on some of this gel like this and you're just gonna disinfect properly your hands, and that's already a good action to prevent transmission. Now you can also, when you need to sneeze, do something like this, and you sneeze into your elbow, and that prevents spreading the virus in the air, or you just stay at home. Okay, so that's a very effective way to prevent transmission. Now what we're doing when we identify a case? In fact, we have in the medical center in the Gare de Vevey, we have had a lot of people who were worried about having coronavirus, and so what we're going to do is we come up with the same questions, like have you been around a person with a high fever and respiratory tract symptoms? We're going to examine them, find out if there is a respiratory tract issue, and we take the temperature. And if we have in fact all these 3 criteria in place, then we take the person, isolate them, put them somewhere else, separate them from all the other people, put a mask, and we have got special masks for that, masks which filter about 49-45% of all the particle exhaled. So that's a real proper, good, effective action to prevent transmission. And then we do all the necessary steps to bring these people to the hospital to do the exams needed to find out if this person is in fact positive. So we are well prepared in the medical center here in Vevey at the railway station, and if you have any questions you can call us. Our phone number is 021 566 5950. Do not hesitate to get in touch with us, and we're probably going to do a second video soon to keep you up to date about this pandemic.